Yes. So this study we're very excited about. It's a cooperative group study by the Australasian Leukemia and Lymphoma Group. It's the WAMM NHL33 study. And there are some problems in mantle cell lymphoma with combining some of the novel agents with more intensive regimens. And therefore we changed our protocol so that we could have a window of Acalabrutinib and Rituximab, and then we delivered RDHAOx chemotherapy 4 cycles, followed by a transplant and maintenance Acalabrutinib and Rituximab. So we used what we call a sandwich approach with the chemotherapy in the middle. And we had very, very high complete metabolic response rates at the end of the induction. That was our primary endpoint, and our CR rate was 88%, which is much higher than a lot of historical controls. We also found that even in patients with what was fairly poor prognosis mantle cell lymphoma having intensive treatment, that the Rituximab and Acalabrutinib yielded an overall response rate just with 8 weeks of treatment of 91%. So we're very pleased with that. Our MRD rate, negativity rate at the end of the induction, Acalabrutinib and then RDHAOx, was also 94%, which is very, very high. So this is our first report of this study, and we'll go on to do further reports in the future with more information about survival and things like that. But we're very pleased with these early results. We also used a hub and spoke model for patients who lived in very remote or rural areas of Australia, and some of these hub and spoke sites were over 1,000 kilometres apart. But what that allowed was that the more intensive parts of the treatment were delivered in the bigger site where the trials were conducted, and then we had satellite sites that looked after the patients in the interim and dispensed the drug and cared for them locally. And this meant that patients could get access to a novel agent such as Acalabrutinib without having to travel, as I said, thousands of kilometres to get it.